I think this is the time for us we're going to have to use good coping skills, and of course, I am a therapist.
Yeah.
So of course I would say this.
Yeah.
I mean, really, this is going to be so key for us right now, in surviving this, right? Because, I always say coping skills are not the solution, but they do really help manage the problem.
Sure.
Yes.
Yeah.
And
Yeah.
they help us stay in control of our anxiety instead of letting our anxiety control us.
Mm.
And so, especially in this time right now, when it would be so easy for our anxiety to control us, if we're able to implement some good coping skills, then we can stay in control of our anxiety.
Definitely.
Yep.
Definitely. So if you were talking to clients today, what are some of those early coping skills we can start to develop in dealing with all this new anxiety?
Yeah. Yeah, I'll give you a handful of them.
Awesome.
The first one I always say, and I think I said this last time I spoke, but nobody really loves this one because it can seem a little boring, but it's actually one of the most effective coping skills is deep breathing.
Mm.
Yeah, definitely.
And so,
Okay, I
yeah,
just saw one of my friends does a ton of coaching on breath and all this stuff about it. For the deep breathing, I don't know if you've heard or know anything. What's the difference between doing it through your nose or your mouth?
yeah. So I always tell people to try to do the deep breath into the nose and then exhale out of the mouth. We just usually see that we can fill our diaphragm more when we're taking that breath through the nose. And that's the hope, right? And the diaphragm really is just think about trying to expand your ribs. Like if you're trying to expand your rib cage, that's what you want to feel.
Yeah.
Like fill the air. Sorry, there's my Texas accent. Feel.
I like it.
But fill with air. Yeah. And so that's a good way to think about it because we want that diaphragmatic breathing. And I would suggest doing 5 minutes a day, especially right now.
Yes.
Even if you're having a good day, I don't care.
Just do it.
Yeah.
Yep, 5 minutes a
Preemptive.
day.
Yep.
And I tell people try to do 4 counts in your nose and 4 counts out of your mouth. And then see how that feels. If you feel like you're suffocating, well, that's not the point. So reduce that number to like 3 and see how that works for you.
Okay.
Some people have a hard time staying focused in that. So, we talk about mindful breathing, which all that means is that you're focusing on, okay, what does the air feel like as it's going in my nose? What does it feel like when it's coming out of my mouth? What is my body doing every time I breathe? Noticing how your body rises and falls, right? So you're just being mindful of what the breathing is feeling like in your body.
Yeah, helping you stay completely present.
Yes. So that your mind doesn't wander out to anxiety world, right?
Yeah.
Yeah.